Si se mueve ficha, que sea por la salud.
Padmapur region in Bihar is a remote area in southeastern India. Malaria is a major health problem. Although the disease can be diagnosed and treated easily, if not spotted quickly, it can escalate. With only 3 doctors for a population of 24,000 people, most cannot access healthcare when they need it, and local people often resort to selling their land or possessions to pay for expensive private treatment. Sometimes children are even mortgaged to a landlord in order to pay for treatment of a sick family member. Fakir Rout is the coordinator of a local NGO network supported by ActionAid.
People are spending large amounts of money on treatments. It is affecting their livelihoods, and slowly people are becoming poorer. It is a sad state of affairs. The citizens of this region have raised the issue with the district administration many times, but the administration just blames the government for not appointing a doctor to the area. It is a region with no education or transport infrastructure, so doctors aren't interested in relocating here.
When my contractions started, my mother-in-law and neighbours helped transport me to Balangier on a bullock cart because my husband was away working. I had a difficult birth and lost consciousness for hours afterward. I was unable to afford to stay in the hospital, but if I left, I'd have to pay for the medicines I needed to take.
Now the village has the medical personnel it needs, but this has been hard won.
We put in a lot of effort sending letters to the Chief District Medical Officer and the Minister. We've now had a doctor for a few months, but the doctor only comes 3 days a week. Overall, things are only a little better.
This is one of many remote rural communities in India, which are often cut off from basic health service provision. With the support of NGOs and central government, communities are working to take matters into their own hands. This volunteer community-based health worker, or ASHA, works across 2 villages and 1,300 people. She has received basic training in malaria treatment and prevention, maternal and child health, as well as hygiene. The majority of these volunteers are women. But with little training and a large population to attend to, there's a lot she can't do. She can't dispense drugs, and if there are problems with childbirth, mothers and babies still die. 36% of people work as migrant labourers in neighbouring states, so men often spend long periods of time away from their families. This makes women and children especially vulnerable to HIV infection. The sad fact remains that misinformation about transmission and treatment, along with stigma, still exist.
I remember a case where a doctor found out that a pregnant woman was HIV positive, and he refused to admit her to the hospital. She ended up delivering her baby on the hospital's veranda. When her husband found out that she was HIV positive, he committed suicide the same day. Everyone blamed the wife, saying that she was the reason her husband died. So you see, there's a lot of ignorance and stigma around HIV, and this can start with the health establishment itself.
What we really need is a house for HIV positive people to stay in when they have nowhere to go because of discrimination. We also need an antiretroviral treatment centre in Balangier.
In the village of Kolhan in Bolangir district, local people are holding a rally to take their concerns to the chief medical officer.
Here in Kolhan, the primary health centre has only 1 doctor for a vast area. We really need 5. As a result, many of our people don't access health services. Many of our community are poor and migrate to other places for work. This puts them at risk of HIV. Today we're holding this rally to voice our grievances.
Community members present their concerns to the Chief Medical Officer, asking for an intensive care facility to be established, increased access to vital medicine and more medical staff for the community.
The people's demands are justified. A senior doctor has just retired and there is no one to replace him. I'm working alone, and although I want to provide services, sometimes it's impossible. Although doctors are often spread thinly, from a humanity point of view, irrespective of the salary and the facilities, the doctors should still provide service to the people.
But there are signs of hope. Anganwadi centres are a government-sponsored mother and child health program throughout India. Mani Marji, an Anganwadi worker who provides care to 1,400 mothers and babies, has been in the profession for 10 years. She describes the changes she has seen.
Thanks to the regular intervention and advice that the Anganwadi and other health workers provide, there's now a lot of awareness of the importance to deliver babies in hospital, for example. At the same time, there has been a decrease in health problems. These are big achievements.
Sankirtana is 40 years old and lives in the village of Sampakapalli. He's suffered from TB, and although cured, he continues to experience chest problems. With no income, he's unable to afford the 2,000 rupees required for medicine. Jamuna is a community worker who arranged to give Sankirtana 500 rupees from the village committee.
सेनु खासले तम खासी देले ब्लड बाहर छ बोले को कहतिले आ मेडिसिन पदर काना लिखि करले और बाकीटा तमे औषध खेबी बोली आस करछो कि नै औषध वाला ब्लड पड़ले तो औषध दरकार होइसे न ब्लड नै पड़ले हमको पैसा पतर सुविधा আছে तम पाके सुविधा नै.
Thanks to the efforts of community workers, volunteers, NGOs and civil society, there is a way for India's most marginalised to access the basic care they need. It comes down to people standing up for their rights and demanding good governance. In India, this will be a long process.